Hi, I'm David Lang. This series of filming is just for the American Massage Therapy Association's meeting on March 29th here in Albuquerque, New Mexico. This is a very short version of active isolated stretching to give you an introduction of what active isolated stretching is. A little bit of cautions before we go on is that if your patient or your client has a hip replacement or fusion of the low back, or fusion of the cervical spine, or any kind of condition where the person can be injured at any time, I want you to stop. The whole purpose behind active isolated stretching is to give a safe, precise movement and stretch program to your patient and your client. Aaron Mattis, who is the teacher and the one who designed active isolated stretching, is more than happy for you to be learning this any way you possibly can. If you'd like to work with Aaron, he's in Sarasota, Florida. You can get a hold of him or his two sons that are there. This is one of his books that he wrote, and you can go online and get this at aaronmattis.com. That's A-A-R-O-N capital L period Mattis, and they'll be more than happy to send it out to you. The other book that I use a lot is from a couple of Aaron's students they're a father and son athletic training team in New York City. That's Phil and Jim Walton, W-H-A-R-T-O-N. It's called The Stretch Book, and this is, you can get this on Amazon.com. Sometimes I even get this for $3. I've gotten this for $3 if you go for used books, and it turns out they're fine. This is really good for patients to take home. The last thing you're going to need is a stretchy rope. This rope is very solid. It's not a TheraBand rope. You need about 8 feet of this. You can get it at Lowe's or Home Depot and they'll cut it for you. You can give this to your patient for about $8 to $10, or they can go do it on their own and get it from them. So I'm David. My model is Denise. She's going to be coming in and working with me now. The whole purpose of this is to just give you reinforcement information for the class that will be taught on March 29th. Okay? Thank you. So we're going to start off in a supine position, meaning tummy's up. I have a pillow underneath Denise's head just for support. There's two ways that I want you to think about this. It's a very light stretch program, and I'm just going to go through this series so you know what you've learned in the class. First is, we're going to have your right hand on her right foot and the left hand under her knee. We're going to push in 1/1000, 2/1000. Most of the time, therapists go towards the chest. I want you to go towards the shoulder. And then you're going to release all the way back down. Some people can't actually do this right away, so just do it nice and easy. Many times I hear people say, hey, I don't feel anything from this. It's okay, because what you're doing is pumping blood and oxygen into the musculature. Right now we're working on the inner rotator muscles of the hip joint. You're not only doing that, you're getting benefit in the knee and in the ankle. If you see the way I push my hand back and then I bring the foot forward. We're going to do this 8 times and let it go. Bring it all the way back down. 1/1000, 2/1000. Let it go. Again. 1/1000, 2/1000. Let it go. Again. Now I want the patient or the client to actually do it themselves, because they're going to have to do it by themselves at home. So Denise, go ahead and grab your right hand here and your left hand on your knee. And you're going to go all the way to your shoulder. How's that feel for you? Good. Okay. So we're about 10 to 13 times already. So we're going to go to the other leg and do that. Now you're going to get my backside. I just want to warm her up correctly. We're going to go back. 1/1000, 2/1000. Let it go. Again. 1/1000, 2/1000. Watch my body mechanics also. I don't strain when I do this. Most of the time I have big athletes who I work with, or I'll work with people like little babies I'll even do this on. And again, feel okay? Go ahead and do it yourself. So left hand is under here, right hand's at the knee. So we're going to the shoulder. And last time. See how much effort I'm putting into it? Not much at all. Because you have to go through an 8-hour day Just take it easy on your body. Next, we're going to do the hamstring stretch. We're going to do the whole leg hamstring stretch. So we're going to bend the left knee to support, because we want this hip to be supported. This is where we can actually start using the rope. I have a noose here, a slip knot, and I'll show you in class on how this works, because this is the hardest part of the class, is to get the knot. So we're going to wrap the noose around the foot. Denise is going to grab it with both hands. We're going to bring that leg up all the way. And if a person can't get, like Denise can, to this part without bending the knee, point your foot going down, just bring her to where that knee stays straight. We want the knee to stay straight the whole time. Point going down. So you're going to flex the foot coming up. Good. Point the foot going down. Does that feel okay?
Feels good.
Flex the foot coming up. Point the foot going down. Again, flex the foot going up. And point the foot going down. Easy, easy. Now let her do the work. It's easy. My first treatment with the patient, I don't even use the ropes. Just because of the fact I want to get to know them, I want to see how much their range of motion is. So understand, if a person has a hip surgery, if they've had hip replacement, you're not going to do this much with them. You're going to be very light, maybe this far at the most, because you don't want to knock that hip joint out. And you can very easily do it if, in fact, it hasn't been there for a good period of time. So that's about 7, 8. Okay? Then we're going to switch to the other side. Go ahead and bend your right knee. And you're going to do this on your own. Okay? Flex the foot coming up. Good. Now you can see she's already in a 90-degree angle. Many times I'll start off and I'm at a 35 to 45 degree angle. And once that blood and oxygen starts getting into the hip joint itself, you can go all the way back. I had work with ballerinas and they'll get their leg all the way down here. And they go, I don't feel anything. But that's okay, because you're not there to tear muscle fiber. You're there to actually get blood and oxygen. That's where the healing portion comes in. So understand, if you're doing a static stretch and you feel that burning sensation, that's actually little fibers tearing. And that's okay for the condition of like an athlete or a ballerina or someone. But if you're in my facility, you're going to be here for rehabbing. So I don't want to have to create pain for you, because I figure you're already in enough pain as it is. Is that okay? Good. The next one is the tensor fascia lata stretch, which Denise definitely needs today. It's on this side here. You're also getting the vastus lateralis, and you're getting sometimes the inguinal ligament in the groin, actually. So we're going to go from outside to inside. Now remember that outside to inside, you put the rope and wrap it around the outside, and it goes on the inside. So you're going to pull cross midline. So the right leg's going to cross the left leg. Now watch this. In order to support the person, we're bringing that left leg over, and you as a therapist can just stand here. Look where my hip is. Look where her foot is. So I don't have to go, ugh. It's just cross over. Go ahead and pull. And then bring it back down. Now we're going to do this for 8 times. Is that okay? Mm-hmm. Now watch the little angle that I put on her foot there. It gives just that much more of a stretch. So you're getting the different angles and the different fascial planes that you're working on. Good. It's a little bit of shaking there. Does it hurt?
Yeah, that feels good.
That feels good. Yeah. Okay. Denise just did a marathon, and her right hip is hurting her, so her knee is also hurting her. So think about what you're doing. If someone tells you that, what are the body mechanics that you need to be aware of? If this person came to me with a hip replacement, or if they just had major abdominal surgery, I'm not doing this like this. I'm just going to be moving them more on this just a little bit, because I don't want to torque that hip out. And you as a therapist have to listen, listen, listen to that person's body and understand that you have the wisdom and knowledge to do this correctly. And last time. Good. Now let's go to the other side. So, outside to inside. Outside to inside. Good? Mm-hmm. Hip up against the foot, and we're crossing over. 1,000, 2, 1,000. Let it go. Again. 1, 1,000, 2, 1,000, let it go. Again. 1, 1,000, 2, 1,000, let it go. Again. 1, 1,000, 2, 1,000, let it go. So we do this 8 times. Go ahead and do it on your own. And you're going to pull that rope this direction. You feel that? Mm-hmm. Now you're doing that on your own. You don't need my help. If the therapist is in here, you're getting paid $125 an hour or $50 an hour or $30 an hour, you want that therapist to help you out just a little bit more.
Okay.
Good? Last time. Good. Do you feel that? Still feel the same pull.
Yeah.
Now from here, we're going to keep the rope here. I'm going to come back on this side, and I want you to understand, it's just the bent of the knee, the bending of the knee, to where I'm going to get the piriformis muscle. Remember, piriformis is one of the 6 interrotator muscles, and then the sciatic nerve, which is about as thick as your finger, runs underneath and creates all this pain all the way down into the ankle. So, and so many times that doctors diagnose you have sciatica, and the patient comes, "Oh my God, I have sciatica," and it's like a life-threatening disease. It's not. It's probably because your hip might be off, which your chiropractor will help out. Your chi might be off, to where your acupuncture could help out. And then, if you come to me, I just want to stretch the piriformis muscle. And if you look up in Netter's anatomy, you'll be able to see that. Go ahead and bend your knee, and you're going to tighten your rope, and come on over. Feel that in your hip?
Yeah.
So it takes the pressure off the tensor fasciae lata and puts it right into the 6 interrotator muscles. Now watch what I do with my hands. I'm turning that foot just a little bit. If the person has knee difficulties or if they've had knee surgeries, I'm not going to put pressure on the knee. I'm going to go further here, and I'm not going to twist that ankle. Okay? And last time, let's do the other side. So we're going to do it 8 times a piece. Outside to inside still. And again. Now I'm standing back here just for filming purposes. And 1,000, 2, 1,000, let it go. Again, 1, 1,000, 2, 1,000, let it go. Again, 1, 1,000, 2, 1,000. Feels good?
Yeah.
Good. Okay. So that you got the idea of that. Now that the rope is still on this right leg, we're going to go from inside to outside. Voila. So you save time, and we're going to grab the foot with your hand, and you're going to put your elbow, your forearm all the way to your toes, and now I call this a cheerleader stretch, or a Russian split, depending on what kind of personality you might be. I'll actually demonstrate it to who you are. Okay, we're going to go side straddle here. We're going to go all the way out. Now you're getting your gracilis, you're getting your medial vastalis, all the quadricep muscles, which are 4 muscles. You're starting to warm them up. Is that all right?
Yes.
This, you're going to have your supportive leg to the side, and you're splitting it up a little bit more. Good. And with that little bit of pull here, it just gives that much more stretch. Now this one you can go low, you can go medium, depending on how stretchy they are, and you're going to go high. Real simple. Okay, good? Mm-hmm. Let's have you do it on the other side. So, rope goes on the foot, you're going to go from inside to outside. So doing the lateral stretches, you've gone from outside to inside and cross over midline. Doing the medial muscles, you're going from inside to outside, and that's what your foot does. Go ahead and pull out to the side. Good. Okay?
Yeah.
And I'm going to help you out just a little bit because I know you need it today. Good. It's a dance. 1, 1,000, 2, 1,000. Let it go. Again. 1, 1,000, 2, 1,000. Let it go. Again. Don't space out while you're doing this though. Let it go. You're always listening. And if you feel real pull, I can feel a pull in her mid-upper back area by doing this. Once you start doing this a lot, you can do this for any of your patients, if they want you to. Now, I'm not saying that you have to do it on everyone. This is just another tool in your tool chest to work on someone. The last stretch we're going to do is the iliopsoas stretch. Okay, we can put the rope down to the side because I'm going to do this for her. So go ahead and lay on your left side. Face this way. This is where you have to be very cautious if there's any low back dysfunction, meaning there's a cervical, a lumbar fusion at all. If there's any surgeries done in this area, if your hip replacement, these you have to be cautious of. Go ahead and bend your knees all the way to your chest. Now, if the person has had knee surgery, I'm going to hold their leg like this. Bring my arm, right arm underneath the right leg. So I've created a shelf, and I can pull the leg back. My left arm is on the hip, supporting them. How's that feel? Good. Feels real good, huh? Yeah. This is where the iliopsoas muscle. You're getting the iliopsoas at this time. This is for a person who has some type of dysfunction in the lumbar spine. We're going to do here. We're going to put your hand on the hip. Now, if you want to get this whole fascial plane, Denise, go ahead and push your arm forward when I pull your leg back.
My right arm?
Yep, you're going to go all the way forward. Now we're all the way. You're getting this latissimus dorsi, quadratus lumborum, the paraspinals, your serratus anterior. Everything gets worked on here. And the main thing is the iliopsoas muscle. It's a two-headed muscle. You know that. And that connects to the greater and lesser trochanter and to T11, 12 on the anterior side of your spine. So we're just moving through. And you see my back? I'm stretching my back out too while I'm doing this. So she's not paying me for that, but oh well. So if the person has a healthy knee, we're going to grab here. Go ahead and do it again. Good. Does that feel okay?
Yeah, it feels good.
Yeah. Now, how can she do this on her own? This is not an easy stretch to do on your own. So during the class, I'll show you what is an easier stretch, and that'll be in Dave's stretch program. From here, all I do is go around. Go ahead and put your arm back here. And you're just going to look over there. And all I'm doing is nice, easy stretch. Understand, if a person has had a hip replacement or if they've had low back surgery, you are not going to do this. She's a healthy young lady, and I can do this with her. It's just a nice, easy stretch. It's easy enough. That's it. The low back, the lower extremity stretch program. Thanks. So here we are for the upper back and neck protocol. So once again, I want you to be careful if a person has any spinal fusion. You have to be very careful in what you're doing. But listen again and listen to the person's body, feeling the texture of the muscle. First is going to be extension and flexion stretch. I like putting a little bit of myotherapy technique in this too. So we're going to put our left hand on top of her forehead, and we're going to have the patient look down and back. Now, if there's any type of spinal dysfunction here, you don't have to extend or flex this much. This is only for learning purposes. And then what I do with my right hand is I have both my thumb and my index finger on both sides of her spine actually hitting trigger points. And Denise has a lot of trigger points today. So we're only going to do 4 movements this time. That way we can save time and we can go on. The next one is turning to the side, right and left. So I'm going to cross over, put my right hand on her left cheek, and we're going to look to the right and to the center. Again, right. Always going back to the center point or beginning point. 3. And does that feel okay? Yeah. 4. So here we're getting the sternocleidomastoid, we're getting the scalene muscles, we're getting the platysma, which is this one right here, the little thin muscle here, and we're also working on the levator scapula. Now we're going to go to the left. 1 1,000, 2 1,000. Let it go. Again. 1 1,000, 2 1,000. Let it go. Again. 1 1,000, 2 1,000. And last time. Look at the way my hand is nurturing her cheek and her masseter here. I'm actually moving into that to where she's getting that stretch also. Good. Now we're going to go for a tilt. You're on this side, take your left hand over, and you're going to tilt to the left. So hand is over the ear, also moving that fascial plane in here. This is softer work. This doesn't have to be strenuous, because the reality is that you're moving the blood and oxygen into this area. You're getting benefit that way without tearing muscle fiber. Look where my right hand, it's anchoring here. My left hand is anchoring in the ear, on top of the ear and the cheekbone, and she's getting this full supraspinatus stretch, and the arms benefit from it. Okay, on the other side, left side, right arm, hand on the face, cheekbone and ear, left hand's on the shoulder, and the same thing. 1, 1,000, 2, 1,000, to the center point. 1, 1,000, 2, 1,000, back to the middle here. Again. And that rhythm you're going to get, and you're not going to think twice about it. And last time. Good. Now we're going to go nose to nipple line. Real simple. Nose goes to the nipple, and I always say smelling the armpit exercise. So we're going to go here. Now we're going to go here. Now you're really getting levator scapula. And my bottom hand, or my right hand, is actually hitting a trigger point in the rhomboids here. Do you feel that?
Yeah.
Does it feel okay?
It feels good.
So if this person is going to do it at home on their own, they would grab with the right hand, and they would just use their left hand and bring it over, nose to nipple, and you really want to position your arm here. This is where you smell the armpit. I know this sounds kind of gross and everything, but it's just body parts. Ready there? And bring it back to the center point. Good. Again, and you want to do this with them. Show them how to do it on their own. Because you don't want your patients, when they're injured, with you all the time. That's how you build a big, successful practice. Get them in 4 to 6 treatments, and then reassess them. See how they're doing. We're going to do the other side. And you go nose to nipple. Here we go. Grab the chair there, and down. It's okay?
Mm-hmm.
Three and 4. Now, both of these programs take about 10 to 15 minutes apiece. It's taking a little bit longer because I'm talking a lot. So when you're doing this in the treatment, you should get this down in 10 minutes, no time at all. So that's 20 minutes of your actual time for working with a patient, and then go in there and do your massage, or do this afterwards, depending on how the body feels. Let's put your arms in front. We're going to do the chest and the back muscles. So we're getting the pectoralis, you're getting the rhomboids, you're getting the serratus anterior, posterior, you're getting latissimus dorsi, teres major and teres minor. You're going to grab, if you can, the wrist, and you're going to bring them all the way back. Now, Denise has got nice stretch here, so we can do that. If the person is struggling, if they got a shoulder strain sprain, or if they have a shoulder surgery, you don't want to do this much with them. Just pump it to about here. 1, 1,000, 2, 1,000. Let it go. Really feel the limits of the range of motion. And eventually what will happen through time, they'll be able to get way back here. They get back here and they'll go up like this to get more of a stretch. Do you feel that there?
I do.
In your pectoralis muscles?
Right there.
Yeah. And all the way back. See, and you're not hurting yourself at all. Let them do the work. You just guide them along. Good. Now, we're going to do hands facing out. Now we're getting the inner flexors, the biceps, the other ones we got the triceps on. Now we're getting the pec minor, and we're getting a little bit of the subclavian here. Here we go again. We're getting infraspinatus, and we're getting upper rhomboids. Bring it all the way back. You're also getting a little bit of latissimus dorsi on this. It's okay?
Mm-hmm.
No big deal?
No big deal.
Good. So we're going to do the teres major, teres minor, latissimus dorsi right now. We'll get a little bit of the triceps. So we're going to bring the elbows together. Fingers are locked behind the head, and we're going to go out to the side. Now this is where I want you to understand I put my knee up against the back side here, and I tell the person, is it okay if I put my knee and my leg up against your back? And they ask me. So we're going to go here and back. So I'm going to show you that. I'm going to move her around here because I have a swivelly chair. Isn't that neat? We're going to go like this. Here and back. So I can actually support her. And now what I'd like to do is get more of the latissimus dorsi. So I'm going to come here, grab underneath the shoulders, the shoulder blades here. I'm going to go pull up. Is that okay? Mm-hmm. You see that pull up there? So I can actually go like this with my arms, and it's much easier on me. Is that okay with you?
Yes.
See how I'm lifting up there? Good? About 4 times to 8 times. And then here you can actually go, if you feel that strain in the body, you can just move the person around. It feels really good. They're like flying. I'm flying, flying. That's from Peter Pan. And back down again. Good. The last 2 stretches that we're going to do are real simple. We're going to put the right hand down to the side, and left hand goes over the head. And this is where you go, I'm a little teapot, short and stout. Pull. Do you feel good there?
Yeah, it does.
So I have my hand bracing, and I'm going over the head. So now we're getting this whole fascial plane here. This goes even into the buttocks and into the leg, too. Okay? Mm-hmm. 1 1,000, 2 1,000. Let it go. Again, 1 1,000, 2 1,000. Let it go. Other side. 1 1,000, 2 1,000. She could be the ballerina. Go ahead and point your fingers more. Like a ballerina. Okay. She was never a ballerina.
No.
And last time. Good. For the last stretch is, I'm going to move to the side here. Now watch what I do. I'm going to go right knee to right knee. Spread your leg just a little bit. So I always ask, I'm going to put my knee in between your legs here, and you're going to take the shoulders, and Denise is going to look to the left. So you're right, supporting the right leg, and you're going to turn and twist to the left. Again, if a person has spinal fusion, you don't want to do this on them. You have to be the one with the knowledge and wisdom to tell how much a person can handle, and you have to listen, listen, listen. Good. Always check in with them also. Now we're going to go left knee to left knee. Is that all right with you?
Yes.
Okay. And we turn and twist. Ah, that feels good.
It does.
Now, you can see where my hand is at. It's not much pressure at all. It's right at the subclavian and the acromion process here. So I want you to understand, if a person has had a shoulder surgery, you don't want to do it there. Just guide them along. And do you see where my hand is at now? If anything around the neck, if a person has had any kind of trauma, you need to check in with them to see if in fact it's okay to put your hand here. Whenever you're working on a person, when you're going into this area of the body, because we never know who we're working on, the history that they've had. So be conscious of that. These are simple ways to expand your practice, as you know, and also to give people information so they can use it when they leave your facility. This makes people want to come back to you again because you're the one who has the knowledge and the wisdom. I never tell somebody I know what's going on with you. I just work with them and I ask them questions as I go along. So that's it for today. Thank you for being here. Thank you for being with the AMTA New Mexico in our conference. Thank you, Denise. And thank you to my wife, Desiree, who's on the camera.